Hello and welcome. Today we're diving into a potentially life-threatening condition called foreign body aspiration in the upper airway. This occurs when an object, unintended for the respiratory system, enters and obstructs the airway. It's a medical emergency that requires immediate attention. So, what causes foreign body aspiration? The most common culprit is food, particularly in young children who are still developing their chewing and swallowing skills. Small objects like coins, buttons, beads, and toy parts are also frequent offenders. In adults, impaired swallowing due to neurological conditions, intoxication, or even poorly fitting dentures can increase the risk. Let's break down the pathophysiology. When a foreign body enters the upper airway, it triggers a cascade of events. The body's natural reflexes, like coughing, attempt to dislodge the object. If unsuccessful, the object can become lodged, partially or completely obstructing airflow. This obstruction leads to decreased oxygen levels in the blood, known as hypoxemia. Complete obstruction can rapidly lead to respiratory arrest and, tragically, death. The location of the obstruction, whether in the larynx, trachea, or a main bronchus, dictates the severity and specific symptoms experienced. Foreign body aspiration affects people of all ages, but it's most prevalent in young children between the ages of 6 months and 3 years. This is due to their tendency to explore the world by putting things in their mouths, combined with their underdeveloped swallowing mechanisms. While less common in adults, the risk increases in older adults and those with neurological or anatomical issues affecting swallowing. There are no specific statistics to mention, but it is a leading cause of accidental death in children under 1 year of age. The signs and symptoms of foreign body aspiration can vary depending on the size and location of the object, as well as the degree of airway obstruction. Sudden onset of coughing, choking, and gagging are classic indicators. You might also notice difficulty breathing, stridor, a high-pitched whistling sound, cyanosis, which is a bluish discoloration of the skin due to lack of oxygen, and an inability to speak or cry. In some cases, if the object is small or the obstruction is partial, the symptoms may be more subtle and could mimic other respiratory illnesses. Diagnosis of foreign body aspiration relies heavily on a thorough history and physical examination. The doctor will ask about the events leading up to the symptoms and carefully assess the patient's breathing and overall condition. Imaging techniques, such as chest X-rays, can help visualize radiopaque, or solid objects. However, many foreign bodies, especially food, are radiolucent and therefore not visible on X-rays. In these cases, a procedure called bronchoscopy, where a flexible tube with a camera is inserted into the airway, is often necessary to visualize and remove the object. While we don't typically classify foreign body aspiration into strict types, it is useful to think about it based on the degree of obstruction. Aspiration causing complete obstruction is a medical emergency requiring immediate intervention. Partial obstruction can present with more subtle symptoms and may require more nuanced diagnostic approaches. Foreign body aspiration is also classifiable as upper airway FBA or lower airway FBA. Upper airway FBA are located in the larynx or trachea, and lower airway FBA are located in the bronchi, specifically the left or right main bronchus. Therefore, a left or right main bronchus foreign body aspiration. The primary goal of treatment is to remove the foreign body and restore normal airflow. For complete obstructions in conscious adults and children over 1 year old, the Heimlich maneuver is the first line of defense. In infants under 1 year, back blows and chest thrusts are recommended. If these maneuvers are unsuccessful or if the patient is unconscious, emergency medical services should be activated immediately, and CPR may be necessary. Once-at-hospital bronchoscopy is usually performed to visualize and remove the foreign body under direct vision. In rare cases, surgery may be required. Prevention is key to reducing the incidence of foreign body aspiration, especially in young children. Keep small objects out of reach. Cut food into small, manageable pieces, especially for young children. Supervise children during mealtimes and playtime. Educate caregivers on proper feeding techniques and emergency first aid for choking. For adults, address underlying swallowing difficulties and ensure dentures fit properly. The prognosis after foreign body aspiration is generally good if the object is removed promptly and without complications. However, delayed diagnosis or prolonged obstruction can lead to serious consequences, such as pneumonia, lung abscess, or even permanent lung damage. Recent research focuses on improving diagnostic techniques for radiolucent foreign bodies and developing less invasive methods for removal. Advances in bronchoscopy have significantly improved the success rate of foreign body extraction and reduced the risk of complications.